In terms of health emergency preparedness, Indigenous Services Canada is responsible for health protection measures and health emergency preparedness for First Nations communities in all regions, and as I mentioned, with the exception of British Columbia, where we fund the First Nations Health Authority. In Budget 2019, the department secured $211 million over 5 years to support increased resiliency and emergency management on reserve. This included specific and the first time ever investments to support health emergency resilience and preparedness in First Nations communities in the amount of close to $80 million over 5 years, with $17 million ongoing. This capacity has been very important to prepare for COVID-19, where First Nations communities and tribal councils and other organizations are able to support First Nations communities in the development and testing of their pandemic plans, as well as knowledge mobilization efforts so that communities can share what lessons they have learned and what are their needs. And that is the foundation of our support services. We also have specific policies and procedures to respond to emergencies in place, and we have dedicated health emergency management coordinators in all of the regional offices, as well as a dedicated secretariat here within the national office. We are working through regional offices, of course, to prepare surge capacity response plans that will relate to additional health human resources that could be deployed in communities based on the significance of COVID-19 in particular communities and their need for additional supports. We are also looking at special capacity supply and response needs, and those would be assessed by communities in collaboration with provinces and also with regional offices of our department.